tongue exercises. When we speak, our tongue, lips, and jaws work in coordination with each other and make our speech clear and understandable. If there is a problem in any of these three organs, the speech or words are difficult to understand. Most importantly, the movements of the tongue are of paramount importance. In some children, the skin that connects the tongue to the bottom of the mouth, frenulum, is shorter. It is known as tongue tie. These children experience difficulty in chewing and in pronouncing certain sounds starting with ta, da, la, ra. Instructions. To address this difficulty, we should help the child to sit properly and feed him some honey. Later, we should apply honey to the child's upper lip and encourage him or her to lick the honey with tongue. Likewise, honey should be applied to both the corners of the lower lip, and child should be again encouraged to touch honey with his or her tongue. We can also stick a chocolate to the palate and ask the child to remove it with his tongue. To improve tongue movements in children with partial vision, we should keep a mirror before them, and sitting beside them, we have to move our tongue and ask the children to imitate the tongue movements as they see in the mirror image. Helping the tongue-tied children to do these exercises daily results in improved movements of tongue, and in turn, this results in better chewing process and better pronunciation of letters and sounds. In case of lack of improvement after all these exercises, an ENT doctor has to be consulted.
Drooling speech therapy. For everyone, saliva helps in digesting the food, lubricating the mouth, and saving teeth from cavities. In some children, especially those who have seizures or fits, muscles in the mouth being weak and the inability to chew, drooling will be more. To reduce this, child should be laid down in a proper way and cheeks should be massaged with backward strokes with almond oil or any other oil. In the same way, the ends of the lips and neck should be massaged gently. By tapping around the mouth gently, muscles in the mouth get activated. Inside the mouth should be massaged gently using Nook brush. Children who are cured of seizures should be massaged inside and around the mouth using a vibrator brush. By doing this twice daily, each time for 5 to 10 minutes, there's a chance of drooling subsiding slowly.
Biting. Generally, children learn biting naturally when teething starts. They put all articles in the mouth and start biting. Gradually, they learn and get habituated to bite on food items too. Instructions. If some children find it difficult to bite, we should place a teether in their mouth between their upper and lower teeth. Then the lower jaw, mandible, should be moved downward and upward. After a few days of this exercise, the child should be given soft food items like biscuits. While teaching the child to bite, one should be careful to avoid the child biting his or her tongue. This way, the children can learn the process of biting quickly. Chewing. Children start chewing after teething, but due to weak muscles in the mouth or lack of proper training, some children learn to chew late. Some children may find it difficult to learn to chew. In such a situation, the child can be trained the skill of chewing by the following exercise. Make the child sit properly. Place the teether in the right and the left sides of the child's mouth between the upper and lower jaw. Now slowly move the lower jaw in a circular motion. Once the child gets habituated to the teether, soft food items like biscuits should be given. Once the child learns to chew soft food items, the training must continue with solid, little hard food. This helps the child to learn the process of chewing. If this activity is performed when the child is hungry, learning would be quick. Sucking. Children learn sucking while being a fetus in a mother's womb. Full-term babies can suck immediately after birth, but preterm babies and few other babies cannot suck and have to be helped to learn sucking. Instructions. To help a child learn sucking, first of all, make the child sit. Now place a thick straw in the child's mouth and close the lips. In the next step, keep one end of the straw in water or juice and the other end in the child's mouth. Again, close the child's lips. Slowly the child will start sucking. Continue this exercise for some time. By doing this, child's lips gain strength, which is useful in talking, in keeping the lips closed while chewing, and in swallowing the saliva without drooling. Blowing exercises. When we talk, our mouth muscles, that is tongue, lips and jaws, move in a coordinated way. This coordination makes it possible for us to make sounds and talk. Some children cannot pronounce letters and words clearly due to the weakness in mouth muscles, especially in lip muscles. To overcome this weakness, child should be helped with blowing exercises. Instructions. To teach the exercise, we have to first ensure that the child is sitting properly. Now take the child's hand close to your mouth and blow air on it. When the child experiences air on his or her hand, they will try and do the same. Now take a whistle and blow it so hard that the child hears the sound. In the next step, place the whistle between the child's lips. Now encourage the child to blow the whistle. Performing these exercises daily will result in child gaining the lip strength. Gradually, the child will be able to pronounce sounds and words clearly. Sounds and commands. It is a language that helps human beings to share and express their ideas, thoughts and feelings. It could be with spoken words or sign language. If someone finds it difficult to comprehend the communication or to reply, or finds both of these tasks difficult, then such a difficulty can be classified as the language disorder. Instructions. Generally, the children first learn to understand small words and uttering letters. If a child has any difficulty in this aspect, sharing should be done through play activities. This way, the child starts to interact. In the next step, slowly pronounce long vowels a, li, u, and encourage the child to repeat after you. While doing this, help the child maintain eye contact with you so the child also understands facial expressions. When teaching children with visual impairment to pronounce vowels for a long time, place one palm of the child on your throat and the other palm on the child's throat. For children with partial vision, we should teach them with the help of a mirror placed before the child. Once the child starts pronouncing the letters comfortably, we should teach him or her small words. Likewise, the child should be taught and follow small commands like give, take, come, go. They should also be taught to use such commands. Let us see how to teach a child to give commands with an example. To teach the child the command give, show the child a toy or a ball and touch the ball to his body and encourage him to say give. When the child utters any sound, give the ball to him. When encouraged this way, the learning process of children could be faster.